What is your body's baseline for reproductive cancer symptoms? Understanding your body's baseline for reproductive cancer symptoms is like knowing what your normal health looks and feels like. It involves being familiar with your regular menstrual cycles, vaginal discharge, pelvic comfort, urinary habits, and testicular sensations. This awareness helps you spot changes that could be signs of issues like cervical, ovarian, uterine, or testicular cancer. Most early stages of reproductive cancers often show no obvious symptoms or only very subtle ones. That's why establishing your baseline through regular self-awareness and routine medical screenings is so important. For example, with cervical cancer, early stages usually don't cause symptoms, so getting Pap smears and HPV testing starting at age 21 is vital. Later signs might include unusual vaginal bleeding after sex, between periods, or after menopause, along with watery or bloody discharge and pelvic discomfort. Ovarian cancer can be tricky because its symptoms are often mistaken for normal digestive or menstrual issues. Persistent pelvic or abdominal pain, bloating lasting several weeks, changes in appetite, frequent urination, fatigue, or unexplained weight loss are common signs. These symptoms tend to be ongoing and gradually worsen rather than happening once in a while. Uterine or endometrial cancer often presents with abnormal bleeding, especially after menopause. You might notice bleeding that's different from your usual pattern, pelvic pain, discomfort during urination or sex, or a feeling of pressure or lumps in the lower belly. Testicular cancer usually appears as a painless lump or swelling in one testicle. Some men might feel heaviness or discomfort in the scrotum. Regular self-exams help you become familiar with the normal size, shape, and feel of your testicles, making it easier to notice any changes early. Vulvar and vaginal cancers can cause persistent itching, burning, sores, lumps, abnormal bleeding or discharge, and pain during urination or intercourse. Recognizing what is normal for you is key because many symptoms overlap with benign conditions like infections or menstrual discomfort. The main idea is to know your usual health patterns so you can recognize when something is different. Symptoms that are new, last more than a few weeks, worsen, or happen more frequently should prompt a visit to your healthcare provider. Chronic or unusual symptoms are red flags that need medical evaluation. To establish your baseline, keep track of your menstrual cycles, noting any changes in bleeding or discharge. Perform regular testicular self-exams to check for lumps or swelling. Pay attention to any new pelvic discomfort, bloating, urinary changes, or fatigue that lasts beyond a few weeks. Follow your doctor's recommendations for routine screenings like Pap smears, HPV tests, or pelvic exams. If you notice persistent or unusual symptoms, even if they seem mild, don't hesitate to seek medical advice. Remember, early detection is crucial for successful treatment. Your body's baseline is your normal health state, and understanding it empowers you to catch potential problems early. Always consult healthcare professionals for personalized advice and evaluation.